This video we're going to talk about brachioradialis. Brachioradialis has a proximal attachment along the supracondylar ridge of the humerus and a distal attachment along the styloid process of the radius. The actions are going to be flexion of the elbow joint and pronation and supination to neutral of the radioulnar joints. So the sagittal plane action is flexion of the elbow. So if I start with a neutral position and I start to contract, we can see the muscle shortening, and that is more specifically action at the humeroradial and humerolnar joints, and it will actually have the best leverage in a position of radioulnar neutral. Then at the radioulnar joints, it's going to do pronation or supination to neutral. What that means is from a supinated position, this muscle will have a little bit of leverage, a little bit of a medial pull on the radius to contract into pronation to a neutral position. In a pronated position, this has a little bit of a lateral pull along the radioulnar axis that can pull to neutral. So the radioulnar axis goes through the head of the humerus proximally and through the ulna distally. So in a supinated position, and this occurs when the arm is straight as well, but we have a little better leverage and thus a better visual if the elbow is bent. So the axis will be here going right through the ulna towards the camera. So this line of pull is a little bit medial on the radius, so we get a little bit of shortening, or if we look at it from that side, supinated, pronated to neutral, and we see some slack in the muscle. Now if I keep going, we see that muscle stretch again. So now there's a little bit of a lateral pull on the ulna that can rotate around that longitudinal axis and can shorten to neutral.